What is culture if not the soul of a people? It whispers in the sway of a dance. It is the unseen architect of the spaces we call home. For Turkana women, it holds the power of creation, shaping not only how they live, but also how they bring life. Apua is about to become a grandmother, but her daughter's experience of giving birth will be very different from her own.
Turkana mamuna bathwa bore nchege kitegemere ana wala akdore ni chai do ne yo karaine ama na to kana ko kina to tingi kini akaina ni dirubo kitegemere tedwa ni kitegemere dirubo mamru bokala bitare na ko pokodi
bala yo ko ni alimai
Kalau bayang dia berbeda apa ni ko ni ben nyu tu na nyu
ko ni tu ako ne lo dia kamala ni de tembe unia dia ngol kinya biro maya ya jaka pewa
apa ji ba yo akize ken ko langa ngawuzin ta itu kang tanga ko podo to ibere cheni be yo Turkana itidang mesma ko podo.
Unlike her mother, Alim will deliver her baby at the healthcare facility.
The issue of choice over delivering over the bed and down here crouching was evident everywhere when you are working in facilities outside town.
Women in Turkana County traditionally gave birth at home, relying on traditional birth attendants due to limited access to healthcare. For these birth attendants, crouching became a method deeply rooted in their culture, a practice passed down through generations.
Megini kay na bona ya ko to na taw kenya tigi boy wan dangani ka
Alim will soon welcome her fifth child, guided not by the calendar's count, but by the appearance of a new moon. In this remote expanse of Turkana County, the sky writes life's chapters, and she watches, waiting. This time she must do it at the hospital. Her first birth at home was a storm she barely survived. She was lucky to make it out alive, but many women don't live to tell the story. In 2014, only 23% of child deliveries were attended by a skilled provider, with many women delivering their babies at home.
Some of the information that used to come over from our community health workers, that some of the reasons as to why those deliveries were so, it's because of some perceptions the mothers were giving outside there. That when they come to the hospital, some of them are used to their normal way of delivering, crouching. But you go to the hospital, you are subjected to delivering in a high couch, that which you are not used to. And because some of these hindrances were identified and some interventions brought on board, like for example, the birth stool we have over here. This is the birthing stool with a number of its components. This is a stool where the health worker sits on. And this is a birthing stool cushion that is always down here. And it has a curvature, a semicircular curvature at this point. This is where actually the health worker receives the baby. Those are some of the ways actually that with the time encourage majority of them to come over, because they were now allowed to deliver their own way.
Mariam is taking care of Alim and other pregnant women in the village. She encourages them to seek hospital services and offers them a choice between the birthing stool and the bed.
So far niko na pregnant mothers kwa kijiji yangu wangapi? 10. Hawa 10 kama 8 hivi ni wa hiyo birthing stool ya crushing, lakini 2 ni wale ya kufanya nini, ya kulala.
Birthing stool has actually improved the attendance of skilled delivery in hospitals, especially hospitals situated outside towns like these.
Sasa utarudi nyumbani, lakini ukiumwa sana usiku unarudi hospitali, sawa?
Wakati birthing stool ilikuja, akaona birthing stool ni very safe na is clean. Maana ukipata wao postinato wenye wanajifungulia nyumbani, mtu anajifungulia mtoto kwa mchanga, kesho yake ukumrifaa usie kichwa yote imebeba mchanga.
But this trend is slowly shifting, with many women seeking healthcare services.
Ye kopungini ya yini za bunya ta yar tro pelinga dore la tanda boy kin cha kop doy ko kop.
I would say it's been a big game changer in a situation where if you really compare it, previously you would get numbers of home deliveries at some point being even more than that deliver in the hospitals. But with the advent of this, introduction of this, the numbers for skilled deliveries, hospital deliveries, are slowly overtaking that of home delivery. Actually, the home deliveries numbers are quite minimal nowadays. I would even maybe say that it's what is improving the numbers of deliveries in facilities that have it than those that do not have it. I think one of the things critics would say is that that ability for the health worker to actually conduct that delivery, it doesn't offer you that opportunity to even see, to even actually be in a position to receive that kit in the most formal way, control and be able to prevent a tear. With that civilization, with education, I see that in the future probably there will be reduction in using it.
A new day doesn't always begin at dawn. It could be any time, like this moment. Alim's safely home, cuddling her newborn, Lily's Caroline.
Ento kana mga siya la karikan ro chan kan rak ni aku. Etu tikni aja kon. Ayi ni aja kon. Ngarake ku dika ko da ni adakit. Mamu chan ngiche. takan na bangache kidi gono berni ak mari yang arab